At birth, Chase Sadowski suffered a neurological injury, severely impairing his motor skills. Now 17, for Chase to get from one level of the house to the other, two aides have to carry him up and down the stairs. A lift, paid for by New York's Medical Indemnity Fund, is broken. Chase feels trapped, and he blames the fund.
It's hard to put into words the emotions that I feel, besides straight anger, because of how much was taken from me.
Typically, patients who sue for malpractice and win get a substantial award. But in New York, the hospital or doctor found to be negligent is only on the hook for part of the damages. Instead of paying for future costs, New York enrolls these kids into the fund with the promise of a lifetime of care.
I just feel we were lied to.
Chase's dad, Walter Sadowski, says long before the lift broke in 2020, the fund approved an elevator stating it's medically necessary. But the costly project stalled, as did modifications to Chase's car.
Where's these environmental modifications? Where's these vehicular modifications? I don't get to spend that much quality time with my son because I'm too busy fighting for the things that he needs. Good.
Other families complain about reimbursements. David Diaz says services like transportation are being denied for his daughter, Judalise.
Good.
Every year it gets tougher and tougher to get the same services we're getting now.
There's no new investment.
The New York Department of Health oversees the fund. During a state budget hearing in January, Senator Liz Krueger asked DOH about the future.
We have a legal obligation to the children that are in the fund for the rest of their lives. What's happening?
We have not stopped enrollment, and if we did, we would notify you as well as others.
But 4 months later,
why wasn't anyone told?
DOH quietly stopped enrolling new applicants. Families tell CBS 2 they found out by reading a notice on the state's website. Governor Hochul's office says she put $58 million into the fund to reopen it until next spring and provide necessary support to impacted families. According to Senator Krueger, in 2011, hospitals lobbied and agreed to largely pay for this fund as a way to curb skyrocketing insurance costs. But the $58 million just transferred didn't come from hospitals. It came from you, taxpayers.
We still desperately need malpractice cost reform.
Laura Alfredo is with the Greater New York Hospital Association. Records show in 2012, hospitals began contributing at least $30 million into the fund.
It's not a dedicated funding stream.
Should it be?
We've been very clear since this all happened in May that we are open to talking about alternate ways of funding the MIF.
Now the fund needs more money as additional children are injured by malpractice. CBS 2 asked DOH for statistics on birth-related injuries. Are babies safer now than before? The state pointed to initiatives to create safer birth experiences, but shared no data.
Are hospitals doing enough to crack down on doctors who make mistakes?
There's certainly more to be done, but there are lots of reasons for bad outcomes.
Senator Krueger says it's time for all the stakeholders to discuss the fund's future. She's proposing a public roundtable.
I would really love to see a commitment from the governor that her agencies will be there.
It hurts to see what is happening to these kids that can't even speak for themselves.
How many seconds you stay up is how many minutes you get to watch the movie for.
We met Denise Olivo at a physical therapy clinic on Long Island. She's pushing her son, Gian Raul, or Gimo, to hold his head up.
17, 18, 19.
Difficult, but necessary. Olivo says at birth, Gimo suffered a neurological injury that severely impaired his motor skills. Each summer, to get stronger, he travels 2 hours from home.
1 whole minute, yay, G!
Gimo's one of 1,000 kids in New York's Medical Indemnity Fund. In other states, patients who sue for malpractice and win get a substantial award. But in New York, the provider found to be negligent is only on the hook for part of the damages. Instead of being awarded for the payment of future costs, the state mandates the children get care through the fund.
I'm tired of fighting, but I don't have an option to not fight. He got terrible hand of cards given to him.
The fund pays for the summer sessions, but Olivo says they don't cover the required lodging, so the family pays out of pocket for the hotel. Then there's the van.
So this whole piece right here was about $30,000.
Jimo's dad showed us his son's wheelchair lift. That claim denied.
What we were told is buy the van and you convert it, you pay for everything, we're going to reimburse you. Now they're telling us we didn't follow the rules specifically of what they were looking for.
Also denied, the family says, the structure that covers and protects Jimo's elevator.
They're denying us accessibility to our own money.
It's frustrating because no one really cares.
Other families agree.
I just feel we were lied to.
They say they lost half their settlement when they were pushed into this fund. And now they're constantly battling confusing coverage rules.
Every year it gets tougher and tougher to get the same services we're getting now.
Then in May, the state suddenly stopped enrolling new kids into the fund. State Senator Liz Krueger called for a public roundtable.
I would really love to see a commitment from the governor that her agencies will be there.
But 2 months later, still no commitment from Governor Hochul. We sent emails to her office, then spoke to her at a recent news conference.
We got one from town. To anybody else?
I have a question about New York's Medical Indemnity Fund. Earlier this year, you saved the fund, so families are grateful to you for doing that, Governor. However, they have deep concerns about the fund's finances and its future. Are you committed to simplifying the process for these families, and if so, when?
This is a very important fund. I agree with the families that we need to continue this.
The governor noted in May she did bail out the fund.
All these decisions are made in the context of the budget, so we'll be getting our next budget negotiations with the legislature and looking at a full review of the whole program.
Will you come to the table to simplify the process for them?
She knows there's a problem.
Westchester Assemblymember Amy Paulin chairs the Committee on Health. She's in touch with Jimo's family. She says she hopes behind the scenes the state is seeking a solution. We'll know in January when the governor unveils her budget.
I think your story is going to be very important. When you actually see the family and see the child, how do you not address it?
Yeah, this is the first time they're meeting.
Face to face for the first time, families and children enrolled in New York's Medical Indemnity Fund. Injured at birth by medical malpractice, they sued and won. But due to a unique law enacted under Governor Cuomo, the state dissolved half their settlement, promising lifelong care. Minutes after coming together, one child had a medical episode.
He's fine. He's fine. He's fine.
He had a seizure, so it's very mild.
Since my son Chase doesn't suffer from seizures, it's tough to see another child in this fund suffer the way other kids do. I mean, not that Chase's condition is great by any standard, but to watch other children in this fund.
Families wanted the state also at the table. In May, they were shocked when the fund briefly stopped accepting new kids. It's facing a projected shortfall of $3 billion. Lawmakers told me they too have questions about the fund's finances.
This is a very important fund.
In September, we pressed Governor Hochul to hold a public meeting. All stakeholders present: Department of Health, fund administrators, hospitals. Weeks later, instead, Hochul's staff arranged for a private call. And those 30 minutes, families say, they brought up concerns like the fund's rejection of mandatory medicine.
We're approved for life, right? But we have letters saying that her medication is canceled.
The fund's delay in fixing a lift.
I had another appeal hearing with the elevator not being installed and the lift not working, that a walkway could be installed for him to access in a different way other than being carried. A judge denied across the board any other opportunities for us.
Families say the governor's staff encouraged them to contact legislators. But legislators tell me they're waiting for the governor to unveil her budget in January.
It seems that a lot of legislators are either not on the committees and they're not well educated or understanding how the MIF works.
Seeing my dad cry like that, this is affecting all of us in our own way.
The fund's impact reaching siblings.
I have an eight-year-old child who tells me that when we're gone, he's going to take care of our son. That is just terrible that in his head, he knows when we're gone, that's going to be his journey.
I just feel incredibly sad for all these kids